Hello everyone, welcome to this global hangout. Today we are talking to the people at the heart of this pandemic, the nurses. From Italy, joining me today, Elena Pradovera.
Good afternoon. It's a pleasure to meet you today. I'm talking from Biella, that is in northern Italy, 100 kilometers from Milan, the center of the outbreak. And I'm working in a sub-intensive unit. At the moment, the situation here is quite critical, so I'm gonna talk about this situation today.
In Spain, we're joined by Carlos del Rio.
Hello, I'm Carlos. I'm very glad to be here and to be invited with you. And I'm an ICU nurse. I'm from Girona, a small region in the north of Catalonia. And I came to Madrid to work in La Paz as an ICU nurse and help in the most affected area in Spain.
And in the US, we're joined by Kristin Baker.
Looks like I'm still muted. There we go. Good morning. I'm Kristin. I'm coming from Burlington, Vermont at the University of Vermont Medical Center. I'm the nurse manager of the emergency department here. We are much earlier in our experience than my counterparts on the call and in the preparation stages of how we're going to handle the influx of patients we expect to see.
Well, guys, thank you so much for taking the time out to speak to us right now on top of everything that you're dealing with. And with that in mind, I want to ask you firstly about what you're seeing. Elena, firstly to you, you're in a hard-hit region. Have you ever seen anything like this in your career?
No, I don't think so. And even when I worked in London, I was working in Croydon, and it was quite a busy area, but I never saw this before. Our hospital is about 400 beds, and half of them are now for COVID patients. Our sub-intensive care unit is normally as 20 beds, and now we have to double to give all the patient all the care they need. So the problem is that we don't have enough nurses to cover all the shift. So we are quite tired now at the moment. We are doing 12-hour shift, and some of my colleagues had to stay for 24 hours at the beginning of the outbreak just to settle down all the stuff inside the ward, because we were the first unit in this region to open the ward for the coronavirus outbreak.
Elena, the numbers already speak for themselves, but I just wonder about what you're seeing, if there are any patients in particular that just stick in your mind.
Yeah, of course. I think there's a lot of them, but one in particular, we have a 38 years old patient that is in a sub-intensive care unit because he needs a CPAP support ventilation, and his dad was by his side, but then he fell ill as well, and he went to ICU, and he died there 2 days ago. So obviously the guy was very, very sad, and his mom is at home ill as well. The patients here are completely alone because the ward is closed for the risk of infection. And this guy is so young and is completely alone at the moment in the ward, and he cannot even say goodbye to his dad. It's like, why we have to face this kind of situation? It's so sad.
It's so sad. And I wonder if others have thoughts about, how do you treat your patients when they can't have that contact with their loved ones? That must be so hard.
Fortunately, we got internet connection inside the hospital, so we can use the cell phone to call the relatives at home. But sometimes, can you imagine an 80 years old patient that sometimes have dementia? They cannot recognize any face around, and they are so lost and sad. And we are trying to do our best, and we are trying to give the best care as possible. But sometimes it's so hard. For us, it's psychologically exhausting.
Carlos, I want to bring you in and ask you about that as well, in terms of what you're seeing there. I mean, that must be an immense challenge, that kind of personal factor, as well as being able to kind of really get to know your patients as well, I imagine.
Yeah, we have a similar situation here. I'm working in a 9-bed in an ICU with 9 beds, now 10 since the beginning of this week, 10 beds. And it's in a space that it's not ready to be an ICU. It's not an original ICU in the hospital, and you can see that affects also the care. Even the other colleagues, the other workers are not specialized in ICU, and even the doctors. And when actually nobody is ready for this and is prepared for something like this. And the patients are sedated, so they have no contact. They are not aware about the situation. But the families are updated every day by doctors and by us. And that's, as Elena said, we are doing our best. And with the resources that we have and with the best that we know.
I want to ask you, Kristin, because you're listening to this from the United States, where I know that you're in Vermont, potentially anticipating a wave of more cases, even potentially coming in as overflow from New York. Do you have a question that you'd like to ask your international colleagues as they're kind of ahead of you on this outbreak trajectory?
I probably have a lot of questions. I think the first one that comes to mind, though, I don't know if there's an answer to it, is how they're supporting each other through this. Are there things, looking back on how they developed kind of their policies and procedures about how to handle this, are there things now that they would do differently if they could?
Absolutely, yeah. Yeah, for example, I've only worked here for 2 weeks. I used to work in Barcelona, but now here I've seen just in 2 weeks that the best that we can do is talk among us with other nurses, with our colleagues, with doctors, talk about what's happening, how do we feel, and that's the best for me to express what I'm feeling and to handle the situation. Actually, that's the best, I think, by the moment to do.
Yeah, I think that the only way to cope this situation is just talk to your colleagues and support each other. Sometimes we just stay maybe for half an hour after the shift and we just eat something together, and so we can talk together and share our feelings.
And we've actually had some questions that have come in on Twitter from people who've directed those questions at NBC News on our account. And I want to ask you, because lots of people want to know, how does this affect your personal life? What about when you come home to your family, when you're dealing with all of this?
Yeah, here the situation is quite hard because today we have the 22nd day of quarantine outbreak. So you can go out just to go to work or go to the supermarket, and that's it. You cannot even see your neighbor. And so my partner is a nurse as well in a COVID ward. So we have to wear mask in the house as well, because we don't know if we have the COVID and we have no symptom. We had this 3-year-old little girl and we cannot hug her. We have to sleep in different beds and using different bathroom, and our life is completely changed since 1 month now.
Absolutely. And Kristin, when you listen to that, knowing that you're preparing your staff for a wave, essentially, what are you anticipating to come your way in the coming weeks and months?
So we're anticipating exactly the same things. Our governor has shut down quite a few things. Our schools have been out for a week and a half, almost 2 weeks now. There's not an official curfew, but the only things that are truly open are restaurants to get takeout food and grocery stores. There's an expectation that nobody is really out doing anything. It's not that there's police enforcing it, but Vermont is a unique place, and a place that is very community-based. So when this outbreak started, people had a very good approach to it and understood why they needed to stay inside and why they couldn't congregate and things like that. I think for my employees, the biggest fear is bringing something home to their families. They're scared to death of being that vector and not knowing that they had COVID, maybe asymptomatically, and could bring it home to their kids, their partners. I've had nurses move out of their own homes because they wanted to protect their families.
Which brings me to the question, I mean, do you have what you need in terms of equipment, guys?
Right now, yes. We have the benefit of again, learning from basically the West Coast and New York City in the United States, plus looking at all the other countries that have been experiencing this and knowing that we have to start acting now to preserve PPE. So I don't know if we're doing enough. It's impossible to know for sure, but we've already started conserving our N95s and looking at alternatives to PAPRs and using industrial respirators. Community businesses are donating. You know, we have big stores like Lowe's and Home Depot in the United States that are donating a lot of masks and supplies, which is great. But different regions of the country are experiencing different shortages. So we feel like we have enough right this moment, but we almost feel guilty because we know New York City doesn't. And there's other places in the world that don't. So it's hard to tell, but we're trying to be conservative about it already.
And what about elsewhere?
Yes, it's similar situation. Well, at the moment we have, where I am in the ICU where I'm working, we have enough resources, but you know that are limited, and we know that in other places in the same hospital maybe they don't, like emergency department, for example. So we are aware that we have to take care of the few resources that we have at the moment, and that maybe in a short future we won't have them. So yes, we are taking care as much as possible of all the materials.
I want to introduce you to someone, Mariah Sharon. Mariah is with us, and Mariah, it's great to see you. Now, your brother, Kios Kelly, was a nurse on the front line working at Mount Sinai in New York. Mariah, just tell us about your brother, because very sadly he paid the ultimate price for his dedication.
Good morning. Thank you for having me. Caius was such a dedicated nurse and colleague, and he adored his patients. He loved his patients and did everything to make sure that they were cared for and that they got what they needed. I'm flooded with emotions right now just listening to your other guests. There are so many things that I'm thinking, and I'm thinking, you know, with Kristin and all of the other hospitals, and you have decisions to make, that to hear that someone else allowed video chats or FaceTime or allowed family to be around, it's bittersweet. You know, I'm thinking right now, I wish someone had done that. I wish we could have seen him or communicated. I know he was sedated, but he would get up, he would wake up at certain points, and it would have been nice. So if that's something that we learn moving forward, how much it means to families, and even that would have made the reality that he was alone, it wouldn't be as challenging as it is.
And we are so sorry for your loss, and we're thinking of you and your family. Now, Caius did a tremendous job working on the front line. What do you think your brother's message would be to other workers around the world in this situation?
Absolutely to fight, to advocate for one another. I also loved your guest that talked about how they talk and commune and to support one another. But I think on the upper level, the top level, to do your best to make sure that your employees have the PPE and the gear that they need in advance. And many places have time. They still have time to do this. And I think also it's such an interesting position right now to be in, to warn our brothers and sisters around the world that it hasn't hit them yet, that again, they have time that to save lives. I mean, that was his life. He was a nurse, to save lives. So his message would be, let's do this and let's do it right.
And guys, perhaps, you know, if you have something you want to say to Mariah as well, feel free.
Well, first of all, I'm sorry for your loss.
Thank you.
Yes, I think the worst thing for nurses, I know doctors do treat patients and persons, but sometimes they focus on the disease. And for nurses, our main reason and our main objective is the person. How is the person feeling all the situation and the family? And biology from a biological point of view, but also from a social and a psychological point of view. And the reason the current situation, we can't take care as much as we want of the people, but we are fighting, and of course we are doing our best. We are hoping at home that I can't get the coronavirus. I need to continue fighting. Right. I can't get it. Right. And we are wishing not to get it, just to keep fighting and doing our best.
Thank you. And I know that. I do. I've heard from so many nurses, and I know that they're trying to protect their families and themselves and yet continue to fight. Thank you for that. Yes.
I wanted to also express my condolences, and I know it doesn't take the grief away. One of the things we're trying to do at our hospital for now anyway is we are getting family members to the bedside for end of life care. We aren't relying just on electronics. We're trying to find one, maybe two family members, and we dress them in PPE and we bring them to the bedside. We can do that for now. I don't know if we'll be able to keep up with that, but we've done that in our own ER. Again, to Carlos's point, that nursing, you know, that connection with people, we just are trying to make it work.
Yeah, thank you. I'm glad to hear that. Thank you.
I'm sorry for your loss, obviously, and I just want to say that we are gonna keep the fight, even for the people that lost that fight. We really just want to be on frontline, because all the people need help at the moment. And even if we don't have enough time to stay with them, we have just to we can just hug them with the words and not with our hands.
Everybody, thank you so much for sharing that today. You know, I mentioned when we started this conversation that some people had been tweeting in their questions to you. Lots of the messages we got on Twitter weren't just questions today. People wanted to thank you. I want to read just some of those tweets, just so you know. People saying, do you know how much we appreciate each and every one of you as nurses, to the moon and back? And then another person saying, no question, just thanks and gratitude. I know I was incredibly moved to talk to you all today. Thank you so much for being with us, everybody. Remember, if you're here on NBC, of course, on Twitter, you can tweet us questions for our next episode at NBC News. Everyone out there, do stay safe, stay at home if you can. If you can't, if you're on the front line, please take care. We're thinking of you, and everybody speak soon. Bye for now.